Picture this. You're getting ready for bed, you glance at the bottom of your foot, and your stomach drops. There's a small hole you've never seen before. If you have diabetes, that's a red flag. Here's exactly what I'd do in the first 24 hours to give that ulcer the best chance to heal. Step 1. Call your podiatrist. Right now. Don't wait for it to look better tomorrow. A diabetic foot ulcer is a medical emergency. Infection can spread fast, sometimes to the bone, and that can lead to amputation. When you call, say, "I am diabetic and I think I have a foot ulcer." That gets you seen urgently. While you're waiting for the appointment, keep it clean, keep it covered, and keep it off it. Gently rinse with saline or clean water. Pat dry, apply a sterile dressing, nothing fancy, and avoid walking on it as much as possible. No home surgery. No digging at dead skin. At the office, expect a full assessment. You'll likely get an X-ray. To make sure the bone isn't involved, they may test circulation to confirm there's enough blood flow to heal. Then comes debridement, removing unhealthy tissue so the doctor can see the true depth and borders of the ulcer. Next, is it infected? Redness, warmth, swelling, drainage, odor, or increasing pain, though with neuropathy, pain can be tricky. They might swab or culture the wound and start antibiotics if needed. Sometimes they'll prescribe antibiotics before the test results, just to stay ahead of trouble. Now, the most common mistake I see, treating an ulcer like a paper cut. Skipping dressings or slapping on a topical antibiotic isn't the move. You want a dressing that creates an ideal healing environment, moist, protected, and supportive of new tissue. Creams like Silvadene or basic antibiotic ointments often don't meet those goals for diabetic ulcers. Better options. Your provider may start with prescription gels or ointments designed for wound healing. If progress stalls, they'll level up. 3 big categories to know. Collagen dressings. Collagen is your body's scaffolding. These dressings encourage new collagen fibers and tissue growth. They come as sheets or powders. Alginates, made from seaweed, they shine when a wound is draining. They absorb moisture and turn into a gel that supports healing. Great for wet wounds, not for dry ones. Foams, the heavy lifters for heavier drainage. They can be a primary dressing or a secondary layer for extra absorption. There's no one-size-fits-all. Your dressing should match your ulcer's size, depth, and drainage, and it should change as the wound changes. If it's not improving, that's a signal to reassess, not a reason to wait. Call your podiatrist or healthcare professional today if you have any issues with your feet. Share and subscribe for more health information.